Hello everyone, my topic is drugs for cough. Subtopics covered are antitussives and expectorants. Cough. Cough is a protective reflex, its purpose being expulsion of respiratory secretion or foreign particles from air passages. It occurs due to stimulation of chemoreceptors in throat, respiratory passage or stretch receptors in lungs. Causes for cough are cold flu, allergic rhinosinusitis, which is inflammation of the nose or sinuses, asthma, smoking, lung infections such as pneumonia or acute bronchitis. Dry cough. Dry cough is a type of cough that does not produce sputum. It can be triggered by infections and cold, which is the most common cause of dry cough, allergic reactions, then trauma, lung cancer, airway obstruction, and other abnormalities. Symptoms of dry cough: flu-like symptoms, which are fatigue, fever, sore throat, headache, aches, and pain. Even nausea, runny nose, which is nasal congestion, is also a symptom of dry cough. Vomiting, wheezing. Wheezing means whistling sound made with breathing. Loss of appetite. These are the symptoms of dry cough. Now, what are the causes of dry cough? Airway irritation, asthma and allergies, chronic obstructive pulmonary disease, which is COPD, which also includes emphysema and chronic bronchitis, congestive heart failure, lung cancer, pleurisy. Pleurisy is inflammation of the lining around the lungs and chest, and even smoking is the cause of dry cough. Now, wet cough. The medical term for wet cough is productive cough. It is common. Its common symptoms are it is common symptom of respiratory infection and allergies and heart conditions. Symptoms of wet cough: absence of breathing, chest pain or pressure, cough that gets more severe over time, coughing up blood, coughing up clear yellow or light brown or green mucus, coughing up pink frothy mucus, rapid breathing, which is tachypnea, and even wheezing. Wheezing we covered right now, which is whistling sound. What are the causes of wet cough? Acute bronchitis, bronchiectasis, which is destruction and widening of airways, bronchiolitis, inflammation of smallest airways in the lungs, common cold, viral respiratory infection, cystic fibrosis, thick mucus in the lungs or digestive tract, even flu, then tuberculosis, serious infection affecting the lungs and other organs. Now, the mechanism of cough. This is important, guys. Stimulation of chemoreceptors, which are present in throat, respiratory passages, or stretch receptors in lungs, which leads to afferent impulses to cough center, which is in medulla. This leads to efferent impulses via parasympathetic and motor nerves to diaphragm, intercostal muscles, and lungs. Increased contraction of diaphragm, abdominal, and intercostal ribs muscles, which leads to noisy expiration, that is nothing but cough. Now, what are demulcents? Pharyngeal demulcents soothe the throat and reduce afferent impulses from inflamed or irritated pharyngeal mucosa, thus provide symptomatic relief in dry cough arising from throat. Antitussives. These are the drugs that act in CNS to raise the threshold of cough center or act peripherally in the respiratory tract to reduce tussle impulses or both these actions. These drugs should be used only for dry unproductive cough or if it disturbs sleep or is hazardous like piles, hernia, etc. Expectorants or mucokinetics. These are drugs believed to increase bronchial secretion or reduce its viscosity, facilitating its removal by coughing. Now, these are the drugs for cough, which include pharyngeal demulcents, expectorants, antitussives. Antitussives are the cough center suppressants, and adjuvant antitussives. Now, pharyngeal demulcents include lozenges, syrups, glycerin, and licorice. Expectorants further classified into secretion enhancers and mucolytics. Secretion enhancers are like potassium citrate, potassium iodide, tolubalsam, Vesica. These are important ones. Now, mucolytics contain ambroxol, acetylcysteine, carbocysteine, and bromhexine. Antitussives are further divided into opioids, non-opioids, and antihistamines. Opioids are like codeine. Non-opioids are dextromethorphan, and antihistamines are chlorpheniramine and promethazine. These are important ones. Now adjuvant antitussives are nothing but bronchodilators. These are salbutamol and terbutaline. Now these are the MCQs related to our presentation, and answers for these are in the last slide. So first one is, which drug acts as centrally and peripherally acting antitussives? Options are codeine, ethyl morphine, phenoxydiazine, benzoate. Second question is, which opioid suppresses cough center for 6 hours? Option A is noscapine, B codeine, C ethyl morphine, D phenoxydiazine. Third MCQ is, potassium iodide is used as a source of iodine solution, or as an expectorant, or as an electrolyte replenisher, or all of the above. Fourth is, ammonium chloride is used as a diuretic, as an expectorant, as an acidifying agent, or all of the above. Fifth is, which of the following is sedative type of expectorant? A lemon oil, B ammonium chloride, C potassium iodide, D both B and C.